So, good morning, everyone, and welcome to our webinar today on the 10-year health plan and how we can support the NHS in delivering this. I'm Jessica Emmett, and my role within NHS Workforce Alliance is the regional lead for the Southwest region, but I'm here today to talk on behalf of the entire Alliance and the support we can offer across the whole of England. So, who we are, in case anybody isn't aware of the Alliance, we are a collaboration of 4 NHS procurement hubs and the Government Commercial Agency, very recently known as Crown Commercial Service, CCS, who have recently changed to the Government Commercial Agency. So, as a team of NHS and public sector workforce experts with decades of experience between us, we are motivated by a genuine desire to make the NHS better. As part of the NHS ourselves, we've been working together since 2019, combining our experience and expertise for the benefit of the NHS, branded as NHS Workforce Alliance. So that is an overview of who we are. And the background for why we're here today and why we're presenting this webinar to you was, of course, as I'm sure everybody is already aware, last July the government published a 10-year health plan for England, and I'm sure everyone is familiar with these 3 shifts as set out by now, of transforming care from hospital to community, analog to digital, and from sickness to prevention. And this webinar is all focused around how we as the NHS Workforce Alliance are ready to support providers, systems and regions achieving these 3 shifts, and how we can support with that as outlined in the following slides. We are also anticipating the government's 10-year workforce plan, which is due to be coming out this spring. We are expecting a focus on retention, productivity, training and attrition of local talent. And of course, the NHSE medium-term planning framework also was published last October, and it built on some of the high-level points made in the 10-year health plan and gave more detail on specific workforce targets with things like reducing sickness rates, implementing the 10-point plan for resident doctors, and adopting the reformed statutory mandatory training once that is published, also coming shortly, as we're told. So to go into a little bit more detail in terms of the specific areas we are able to support you, one of the key themes from the 10-year workforce plan is workforce planning, having the right workers with the right skills in the right place at the right time. We know that as workforce models adapt to deliver more patient care in the community, we have a health workforce solutions framework which can support with workforce design, staffing strategy and establishment planning. As new areas of care get stood up, like neighbourhood health centres, urgent treatment centres, mental health EDs, our frameworks can support with sourcing substantive staff to help man those new services in a compliant and cost-effective way. As we know, recruitment pivots to focus more on local communities. Our suppliers are able to support with talent pooling, recruit, train, deploy methodologies and retention targets. For those providers that are being tasked with creating new posts, for example, nursing apprenticeships, specialty training posts, and also reforming consultant job planning, which was a key feature in the medium-term planning framework. Again, our framework suppliers can provide guidance and expertise in workforce modelling to support with those ambitions. And another area we can support is in workforce technology. Our workforce technology systems framework can help deliver recruitment, employment checks and onboarding software, providing those digital tools which can help make your recruitment more efficient and productive. Just in the box on the left hand side, you'll see we have mentioned temporary staffing because of course temporary staffing reduction does continue to be a key policy driver across the board, and we know that the medium term planning framework stated the annual objectives for 26-27 which continue to be 10% reduction on bank, 30% on agency. We have a really strong track record with helping trusts and systems and regions reduce their bank and agency spend, and we are in a really good position to help you with realising those efficiencies and meeting those targets for temporary staffing, if that is an area of focus for you and your organisation. So moving then on to digital transformation and productivity, of course, we know that moving from analogue to digital is a key theme across the 10-year health plan. And our new workforce technology systems framework, which we launched end of last year, covers not just procuring the software and systems themselves, but also consultancy services to support you with things like digital strategy, systems gaps analyses, implementation and change management, customization and standardization, and also user experience solutions. There is a key focus, as outlined further in the medium-term planning framework, on reforming consultant job planning and that capacity planning, and via our framework, you can procure that innovative job planning technology to help you with that ambition. We are aiming to work with digital leaders across providers and systems to better understand everyone's individual plans and timelines for transformation so that we can support with those. And then also our Health Workforce Solutions framework features suppliers with experience in workforce productivity, enabled and underpinned by digital transformation and integration. And on the left-hand side there, I've just put a little bit of information about the Workforce Technology Systems framework, because it launched end of last year. It's been produced in close collaboration with NHS England, and it is their preferred route to market for the procurement of any workforce technology. So if anybody would like to find out more about that, we will again share information about all of our frameworks alongside details of this webinar at the end. Another area that is a key focus in the 10-year health plan, as I'm sure you're all aware, is around the training and upskilling, developing skills and expanding the capabilities of our workforce. We know that the plan sets out ambitions to have personalised career coaching and development plans, including AI training and digital upskilling for every member of staff by 2035. We know that there are ambitions to recruit thousands more GPs in primary care, and the plan aims to completely reform mandatory training with removing repetitive and irrelevant Statman training modules. We know as well in the medium-term planning framework there were references that the reformed Statman training would be published and implementation will be beginning this spring. So we are keeping our eyes close on that. To support in this area, we do have a learning and training framework which provides fast and efficient access to both standard and niche training options from a wide range of training providers that offer both in-person and virtual training delivery methods. Indeed, last year our learning and development services were delivered across all 7 NHSE regions, so across the whole of England. So we've got a really widespread network of learning and development providers. Our Workforce Technology Systems framework, again mentioning it again because it's just so important to a lot of this activity, is around the learning and management appraisal software that you can use for digital tools to improve the efficiency and productivity of your workforce. So performance management of your workforce, learning and development tools, digital tools are all available via that route as well. And our Health Workforce Solutions framework has a key focus on recruit, train, deploy methodologies and staff retention, which again are all those key areas of focus around training, upskilling, and indeed then retaining staff as well. Building on from the staff retention element, workforce wellbeing is a key theme of the 10-year health plan, taking care of the people who care. We know that it outlines that providers should have improved staff standards around things like food and drink available at work, harassment and discrimination protection, flexible working. We have an occupational health and employee assistance services framework where our suppliers can work with you to ensure your workforce is as healthy as can be, improving staff wellness and reducing that sickness rate, which was referenced in the medium-term planning framework. Again, our workforce technology systems can also support, as our suppliers can provide digital HR technologies for things like managing annual leave, onboarding, management support, payroll, and like I mentioned in the previous slide, appraisals, revalidation, and all of those areas. And our Health Workforce Solutions framework has a key focus on staff retention and strategic workforce models. To elaborate a little bit more in the box on the left, our Occupational Health Services framework, it's a really wide-ranging suite of services that can be procured, including but not limited to, of course, occupational health, but also things like physiotherapy, health screening, counselling, coaching, vaccinations, employee assistance programs, eye care. It covers a wide range of areas that can help make our workforce as healthy as they can be. And then also quicker patient care. It's no secret that there is a lot of attention at the moment on reducing waiting lists, reducing referral to treatment times, improving discharge to access, ED waiting times, and all of those areas. We know that the 10-year health plan mentions continuing to use private sector capacity to treat NHS patients where available, particularly in disadvantaged areas. And we know there is a particular focus on waiting lists, waiting times, and improving care in some key areas. Our in-source services framework can help trusts procure end-to-end clinical services to help you clear backlogs, reduce waiting times across a really wide range of clinical specialties. And indeed, that framework, as you can see on the right-hand side, helped deliver over £9 million of savings via discounts to tariff throughout last year, January to December 2025. And our health workforce solutions framework also includes a focus on workforce productivity, demand management, achieving efficiencies, and new ways of working. So again, there's a wide range of areas that we can support with helping you to deliver quicker patient care. So in summary, I appreciate I've just thrown a lot of information at you, but again, we wanted to really bring to life the wide range of areas that we can support in this world of workforce. In a dynamic and changing landscape, the Alliance is ideally placed to support you in delivering the 10-year health plan, particularly those key areas focused around workforce. We work closely with NHS colleagues at both a provider, system, regional, and indeed national level. So we're really able to support you with collaboration, with innovation, and help deliver that quality patient care. And through our wide and varied suite of frameworks, we can support you in achieving those 3 shifts through the key areas that we've outlined. So workforce planning, digital transformation and productivity, training and upskilling, workforce well-being, and delivering quicker patient care. To give you a little bit of a breakdown, as you can see, this is some of the frameworks that I've referenced, because again, I appreciate it's been a lot of information thrown at you relatively quickly, but this is a good overview of our frameworks. I think historically a lot of people look to us for temporary staffing support, and that's absolutely still an area we can support you with, but we really wanted to highlight today that there is a whole wide-ranging area of other things that we can also support with via our frameworks and via our suppliers. So again, information around all of our frameworks, we'll share this after the webinar, and also you can access on our website. And if you were interested in finding out more and also talking more about any of the areas we've gone through today, I just wanted to flash up that each region has a regional lead. As you can see, I'm the regional lead for the Southwest, but my colleagues also cover, we cover all the regions. So if you wanted to reach out specifically to your local point of contact or your regional lead, these are the contact details for everyone across the Alliance. Again, we will share this after the webinar, so you don't need to remember. And that was everything we wanted to cover today. So I'm going to stop sharing my screen at this point, and that way I can see you all better as well. So it was a short and sweet webinar just to bring to life how we can support with the 10-year health plan. At this point, I'm happy to open up to any questions, comments. Feel free to raise hands. You can pop